Good morning everyone. I am Dr. Ravi Teja Rudraraju, consultant knee and sports medicine surgeon at Apollo Jubilee Hills. Today I am going to talk about patellar dislocations. Patella or kneecap, usually present in the center of the knee, tracks in the center, helping us in bending and extending our knee. The patellar dislocations can happen more commonly during sports injuries or maybe due to accidents and sometimes in terms of abnormal anatomy. The patella or the kneecap is supported by medial structures such as MPFL, and on the lateral side some of the ligaments also support the kneecap. Patellar dislocations can be classified as acute patellar dislocation, recurrent or habitual dislocations, and congenital patellar dislocations. These can happen in high risk groups such as athletes, dancers, teenagers, women, big and tall men, and in some cases the patients having trochlear dysplasia. What are the signs and symptoms of patellar dislocations? Obviously, patients will hear an audible pop followed by intense pain and swelling, and sometimes patients have bruising and also might present with locking of the knee. After the injury, patients are usually unable to walk and sometimes they might see the patella out of place. How the patellar dislocations can be diagnosed? First of all, the proper history involving the accident or probably during the sport is very important, followed by the physical examination. And if required, the surgeon might also ask for an X-ray or an MRI to understand if there is any bony injury or cartilage or ligament injuries. How these patellar dislocations can be treated? First of all, the patellar dislocation should be relocated into the place by reduction and then giving rest for the knee for few weeks. Coming to the treatment, first of all, the patella has to be reduced back to the position. Once reduced, we have to give enough rest for 6 weeks at least, followed by reassessment of the patella. If the surgeon thinks that the patella is not stable, he often encourages the patient to undergo a procedure called MPFL reconstruction. It is medial patellofemoral ligament reconstruction. This helps the patella to get stabilized by the medial structures. Then followed by a proper rehabilitation which would put the patella in center and getting back to normal. In some cases, some patients might have abnormal anatomy and therefore some of the times the surgeons might also advise to undergo a trochleoplasty or tibial tuberosity transfer. How can we prevent these injuries? A proper rehab is very important to strengthen your quad muscles before getting into any pivoting sports such as football, kabaddi, basketball, and any of other such related sports. Similarly, leg muscle conditioning is very important for patients to understand or to avoid these problems. If patients are expecting to get back to normal, so definitely it takes a little bit of time and patience for them to understand that it will get back normal in few months' time. If required, we often reconstruct MPFL in few patients before getting into sports so that they can have a stable knee and patella joint. If you need any further advice related to patellofemoral problems or any kind of free physical examination, please come and see us at Apollo Jubilee Hills to further understand the patellofemoral joint and its related problems. Thank you.